So we now have a model, and the evaluation consists of first kind of testing local tenderness, just evaluating the area. I always screen the entire pelvis and the hips and the low back, but that's not covered in this Coccyx course. We're focusing on the Coccyx, okay? So what I do is I just look at his anatomy, and I'll bet you this is his sacrum, and I'll bet you tailbone is right there. So let's see. Oops, I was off. How about that? That's the tip of his tailbone, okay? So I just rest my hand on his coccyx. Middle finger is near the lower coccyx, okay? His tip is actually a little bit deeper in. So I'm probably on the third coccygeal segment with the tip of my middle finger. Okay, now watch this. I'm gonna put this index finger here and lift up towards his right ear. I allow a little bit of space here. I come over 1 finger width and I lift up, okay? And they are symmetrical, but let's get a really close up. If he really had a side bending, it would be this much difference. And let's get a lateral image as well. I mean, it's not subtle when someone has a side bent tailbone, okay? So that's what it would look like, all right? Now the next thing I'm going to do is come across a little bit, and I know the sacrotuberous is just slightly above there, so I'm just going to roll up and down and dig in there, and now I'm indenting, and I feel like I'm on that ligament even though I'm going through other soft tissues. And then I try to spring it. Now if I can't spring it, that means it's really tight, okay? The ligament is just really tight, and I compare spring on each side. All right, so the palpation is easy. One more time. There's the tip of his tailbone. I come here for the sulcus, and then I come over 1 finger width, and I roll up and down, and feel what is ropey. It's right there. And now I'm going to spring the sacrospinous ligament into his body. Don't let it intimidate you. A lot of you have already done this, but if you haven't, by the time you do this on 3 clients, you'll own it. Okay, so what I'm going to do now is I'm going to come on the right side of his tailbone. So I use my thumb here, and of course I educate them before I do any of it, and I get their permission, okay? So I'm just hooking the coccyx right there, and I like to hook my other thumb on it, and at the count of 3, I'm going to give a little tiny impulse of about 3 pounds. So first I push to take up the slack in the system, and I felt the slightest give, and then it stopped, and 1, 2, 3, thrust. And there's a little tiny movement that must go first through the sacrococcygeal joint, okay, before it goes anywhere else. And if motion is blocked there, that little bit of force is not going to go beyond that joint, okay? Then I like to walk around to the other side of the body, and then I have to get reoriented, but I know the tip should be right around there. There it is. I'm starting to get good at this. Put my thumb, capturing as much of his coccyx laterally as I can. I stack my thumb, 1, 2, 3, thrust it. And there's the slightest little tiny give. And it feels like a really subtle compression. It's not a lot of movement, okay? I don't concern myself with rotation yet. If I've established that he doesn't move going to the right, and he has a deeper or a higher sulcus on his left, okay? And he does spring when I contact the lateral aspect on the right side of his tailbone. I can load it and I can spring it, okay? But I can't do it from the right side to the left. Then that meets the definition of a side bent tailbone. Again, the right sacrospinous will be tight. So the treatment is really simple. I can use that tool I showed you earlier. Can you hand me that tool, please? That blue and yellow tip thing. So this is kind of ergonomically shaped. I can locate myself there. And I can actually push on the tool from the top of it, but also with my thumb. And for some patients, they just may be more comfortable if you show them, I can use this tool or I can use my finger on the tailbone. Do you have a preference? You know, it just gives an option, all right? Okay, so now I wanna make his tailbone go to the right. So I'm gonna roll my thumb on the right side of his tailbone. I'm not going too high, I don't want sacrum, so I'm only going about 1.25 inches length. Okay, my thumb is, yes, so I'm contacting it, and then I take my other thumb and I stack it, and then I just lean it that way. And I'm just starting to experiment with a creative way of inducing a little bit of inferior glide to it. That's a work in progress. So I'm doing a better job of distracting his tailbone that way. And now the distal phalanx is not really contacting tailbone. It's more the first phalanx, okay? So I just push into it and I combine those forces and I hold that for 3 minutes, okay? After that, I'm gonna slide over here. I already know this is the soft tissue land. I take the heel of my hand. I'm gonna go at a 45-degree angle, purely lateral. In other words, my hand doesn't angle up or down, okay? And I just load it. And that's all it took to load those ligaments. And I hold that for 3 minutes. I have never had this fail me. It's a very nice technique. And that's how I treat the side bending, okay? Now we're gonna talk about the rotation. So now I come back, I reevaluate, oh, look at that, his sulcus is equal, okay? And so sacrotuberous ligament is here, I'm indenting it, and now I'm gonna give it a thrust, probably 2 pounds, 3 pounds, and guess what? It springs and it recoils, so it's no longer real tight, all right? We've restored ligament tone. I come check the sulcus, and both sulci are equal. Now I come on the left side of his coccyx, okay? So this part of my thumb is making that contact, okay? And I then load it gently, and guess what? There's a tiny give, okay? Now it stopped moving, so I've taken up the slack. At the count of 3, I'm gonna give it a little impulse with my right thumb. And it's in the order of about 3 pounds of force. 1, 2, 3, boom. And that force translated. So it's moving, okay? Now it's time to look at rotation. So again, here's the tailbone right here. We're close to the tip. So the sulcus is gonna be up here, okay? And so if I'm on the sulcus, I know that I'm on the undersurface of the tip of C1. So I come up 1 finger width, okay? 1 finger width here, and I'm talking, yes. So I'm keeping my eyes there, come around, put my thumbs there. Okay, am I on something bony on both sides? Yes, I am. And he looks symmetrical, the tone feels symmetrical, and I'm going to load him on the right and thrust it. There's the tiniest movement there. I'm gonna load him on the left, so I'm pushing towards the floor with my left thumb, okay, taking up the slack, and now I'm gonna give it a thrust. 1, 2, 3, boom, and it gives. The motion goes in there, and then it goes out and beyond that. So he doesn't have a side bent tailbone, he doesn't have a rotated tailbone, all right? But if he was rotated, then my left thumb would be towards the ceiling, okay? I would be able to take up the slack on the right and spring it, but when I come over to the left of the first coccygeal body, I would not be able to take up the slack. And if you can't take up the slack, you can't spring it. That's just how it behaves. So that tells me he's rotated. So if I lose my orientation, I just come back. There's the tip. There's the sulcus on each side. So the spine, the transverse process is right above it. So that's a safe place to palpate. And if I want to derotate it, remember I'm going to first try and get a little bit of distraction force. So I'm leaning at a 45-degree angle because I have to get purchase. I wish there was a lever here I could just push, but I can't. It doesn't come that way. All right, so I'm trying to get some inferior distraction. And so I will impart firm pressure. So right now I'm actually imparting about 10 pounds of force. And you can practice on an old-fashioned bathroom scale, not a digital one. You can get the cheap ones at Walmart that they're spring-loaded. That's what you want for the feedback. Now I'm just going to push down more on his left side like this. And you can use up to 10 pounds. It's not necessary. I would be anywhere between 5 and 10, somewhere in there. Based on his body, based on the feedback that I get when I test his body. If I had a big football player, maybe I would double the force. I don't know. But it's not a question of how many pounds. It's a question of the body that is on the table. I'm going to use the least amount of force to get the job done. Okay? So I've distracted it. And then I've also added the derotation force. And ideally, 3 minutes distraction. If you don't have time, distract at least 30 seconds. Okay? And then add the rotational force with the pressure on the left side of the first coccygeal segment and maintain that for 3 minutes. I've never had it fail me. Okay? So that's what I would call the second most easy pattern to treat. And the next thing that we will videotape is going to be a pattern of the lower pelvis, one that you don't find if you're palpating everything up here. It's a pattern I found when I started palpating the lower pelvis and the lower pube. You know, most folks treat the pelvis from a osteopathic muscle energy perspective, and they teach palpation of the top of the pubic bones, which is called the crest, and then the tubercle, that bump, okay, which is that like the upper third, but they don't go to the middle third, they don't go to the lower third. I started palpating the lower third and I was just amazed at what I saw. I'll put that all together for you in the next video. Thank you.